parents like to know about is how to do baby CPR. So this is something information that you'll get covered a number of different times. So when you're in the hospital, before you get discharged, your midwife or nurse will go over baby CPR with you. And it's a really good idea to see this today on the video, but then also to see other people going through how to do CPR on a baby, just to get the information in your head so you're familiar with it and you know what to do. It's unlikely that you will need to have to do this, but it's just really good to know what to do just in case of an emergency. With babies, it can be really tricky to know if they're breathing all right, and it is something that you get anxious about. I did as a new parent. When Natasha was talking before about bassinets, the baby sleeping in your bedroom for the first 6 months, right beside usually mum's side of the bed, because mums hear everything. It's really nice because you will wake up from a deep sleep and be, that's right, I've had a baby, and you just want to put your hand out and check the baby in the bassinet and just make sure that they're warm, that they're breathing, and that they're okay. And you will do that a number of times through the night until you get used to having a baby in your room at night. The easiest way and the quickest way to check on them, and this is what I used to do with my boys, if I wanted to know if they were breathing all right, is to put my hand on their chest. And when you're doing that when they're asleep, you can feel their chest rising and falling underneath your hand. Babies, when they're in a deep sleep, they hardly look like they're moving. So if they're asleep in the lounge and you're sitting on the couch and you're looking across at them, it can actually be really tricky to tell if they're breathing or not. So putting your hand on their chest will tell you. The other thing I used to do with my boys is that I would put my finger underneath their nose and I could feel the breath going in and out through their nose, and I'd know they're okay. So you'll find your own little ways of checking on them. If they were in their room and it was dark and you wanted to go in and check, if you put your hand on them and you're unsure if they're breathing or not, then you would start to panic. That's what I've realised as a parent, is that you panic about your children, and often we overreact. But if you're not sure, you're going to pick them up out of their bed, because picking up the baby will give you really good indication whether they're going to respond to you normally or not. If they're in a dark room, you're going to be flicking on lights so that you can actually see them. Their colour also tells you very quickly if they're okay or not. So you'll get used to your baby's normal colour, and if it changes, if it goes a purple or a grey kind of colour, you will recognise that colour really quickly. So if you pick them up, they don't respond to you properly, if they're flat and floppy. If you look at them and you think their colour isn't right, you're not sure if they're breathing properly. For me as a parent, I would start to panic, and I forget everything that people tell me about this next little bit about CPR. So I think it's really important to get on the phone and dial 111. If you're concerned about your baby and about their breathing, dial 111. If you've ever had to dial 111 in the past, one of the first things they ask you is what service you require, and you say that you need an ambulance. The next thing they ask you is your address. So you need to be able to give them your address clearly, and then they say, what is your emergency? And if you said that your baby wasn't breathing properly, they start telling you what to do. And so you're just listening to them, being guided by them, doing exactly what they tell you. And so what they would get you to do is put the baby down on a firm, flat surface. So on a coffee table, on the floor, but just not on a soft bed, not on a soft couch. When you get the baby into that position, flat on their back, without a pillow or anything underneath their head, it opens up their airway. So maybe if something has been restricting them from breathing, laying them flat opens everything up, opening their airway. What they get you to do for the baby first is breathing. And so you cover their nose and mouth with your mouth, and you do 3 little puffs into them. So not like an adult where you're doing a great big blow, you're just doing a puff, so a into them. So mouth over their nose and mouth, 3 puffs. You put your hand on their chest so that when you're doing those puffs, you can feel your hand rising and falling. If you can't feel any changes happening on their chest, then you need to reposition their head and start again, so you get those breaths into them. For the most part with babies, it's the breathing that stops first, and once you do those breaths for them, it helps them to revive again. So sometimes it's just the breathing that you need to do for them. If you do those 3 breaths and then still not responding, they get you to just start doing CPR on the baby. And so you don't need to take their clothes off, you're just guessing where their nipples are on their chest. You're getting 2 fingers, putting your 2 fingers in the middle of their chest, and you're doing compressions that are 1/3 of the way down their chest. If you're just doing it gently, it's not going to be pumping their heart for them. You need to do it 1/3 of the way down their chest to pump their heart. The rates of compressions to breaths that we tell people is 30 chest compressions to 2 breaths. Once you've done those 2 breaths, back into 30 chest compressions. So what we say and how to remember it is 30 to 2, no matter who. Doesn't matter if it's a baby or a child or an adult. 30 chest compressions, 2 breaths. And you keep doing those until maybe somebody else comes to take over, or an ambulance arrives and they take over. Don't stop unless they respond and start to come right again, or until somebody arrives to take over.